Welcome to our ET Talks. I am Diann Shaddox, and with me today is Dr. Drew Christensen, our Chief Medical Officer. Dr. Christensen, or Dr. Drew, is a functional medicine practitioner and also has essential tremor. He is here to provide clear answers to your questions about essential tremor and Parkinson's. This is an important topic that many people are concerned with. So, Dr. Drew, I'm going to let you take over, and if you need anything, just let me know.
Sounds good. So make sure as we move along here, if you have any questions, you can put those in the chat. So you can go down to the bottom of your screen and click on the little chat, and it should open up there, and you can type in any questions that you may have. So make sure you do that. I want to make things a little bit clear. I am a physician. I am not a neurologist, so I'm not an expert in Parkinson's disease. I consider myself an expert in essential tremor because I live with it. And so I know what it's like to live with it. And because of that, I've done a lot of training and research in essential tremor. And in my practice in essential tremor, I really focus on helping people reduce their tremor without drugs and surgery. So that's kind of my area of focus. And so I just want everybody to kind of know that moving forward. Why is it important for us to distinguish the difference between Parkinson's disease and essential tremor? Some people think, well, they're just both shaking, and so why is it important to know the difference? It's really important to know if you have essential tremor or Parkinson's disease, or maybe even both, because they affect different parts of the brain. And so when we go to help the tremor and help the brain, we focus on different areas of the brain because they're different. And so medicines are different. How you would treat it naturally is different because the root causes are coming from different parts of the brain. So that's why it's really important to know what the difference is. So when we look at Parkinson's disease and how it may differ from essential tremor, the biggest difference is that Parkinson's disease is a resting tremor. So the shaking takes place when someone is sitting calm and relaxed and they're not moving. A lot of times their hand or their fingers will be shaking. And many times that tremor is described as a pill rolling tremor. As opposed to essential tremor is a tremor that happens with action. So when we move, that's when the shaking or the tremor is manifested. So we call it a kinetic tremor, a tremor that takes place during action. When we look at Parkinson's disease, some of the other characteristics that may be present are what we call bradykinesia, and that it means slow movements. So when you go to move, those movements are slower than they used to be. There's also something that we call postural instability with Parkinson's disease. And that means that their posture has changed. So they may be a little bit slumped, neck may be forward, and when you look at their posture, they are kind of more leaned forward. So there's some instability with the posture. Other things that we notice are hypokinesia. And what hypokinesia means is that there's decreased movement, and then there's something called akinesia, and that's an inability or a difficulty in initiating movement. So a lot of times you'll see Parkinson's patients when they're trying to initiate movement, start walking, or to start a movement, it will take them a little while to get moving. And that's very characteristic of Parkinson's disease. There's another characteristic in Parkinson's called rigidity. And rigidity means that the movement of the arms and legs may be stiff, and it may be difficult as that movement is taking place. It'll be more rigid or stiff. When we see someone with Parkinson's walk, a lot of times they will freeze. So that means that they have a hard time getting going. Again, that is that akinesia. But when they get going, a lot of times they're shuffling in the gait. And that shuffling is not characteristic of essential tremor. Some other characteristics that we notice are in the facial expression. A lot of times we'll see that there's a lack of expression. There's decreased amount of blinking in the eyes. And sometimes the face is described a little bit like mask-like. So there's decreased facial expressions compared to what we would expect there to be. We can also see other problems with like swallowing when a very telling sign is also as they write their name or sentence, the size of the letters is very small, and that's called micrographism. So the writing becomes very, very small. We also see loss of smell in Parkinson's disease. We can see other dysfunctions in the digestive system. So there's more constipation, things like that. We see increased rates of insomnia, dementia, anxiety, depression are also common in Parkinson's disease. So that's important to notice. Unlike essential tremor, there is a nice study called the DAT scan, and the DAT scan is a special brain scan that looks for dopamine in the brain and how that's functioning. And that can help us diagnose Parkinson's disease. And so those are the characteristics that we typically see in Parkinson's disease. In essential tremor is different because it's a movement tremor. So it happens when we move. We can sometimes see an intention tremor, and an intention tremor is seen when we reach or point at something, the tremor becomes more obvious. So that's why the neurologist will have you touch your nose and then his finger. As you get close to the target of your nose or the neurologist's finger, the tremor becomes more manifest. In essential tremor, we also see something called orthostatic tremor, and that's a tremor that we see when you're just holding your hands out in front of you. That can also cause or bring the tremor out. So, other things about essential tremor, and maybe a little bit frustrating when you go to the neurologist, sometimes it's not super obvious that this is essential tremor or maybe something else. And they'll want you to come back for reevaluation. In the scientific literature, it's now recommended that a practitioner observe a patient for a space of 3 years before they make an official diagnosis of essential tremor. So that may be a little bit frustrating, but it just manifests that diagnosing essential tremor can sometimes be challenging. Both of these tremors, Parkinson's and essential tremor, are progressive, meaning they get worse over time. They both involve the brain, and so it's really important that we take care of the brain to slow down that progression and to try and improve things. Similar to Parkinson's disease, essential tremor is also associated with dementia, anxiety, cognitive problems, depression, and we don't always think of those things when we think of essential tremor. Parkinson's disease involves the basal ganglia part of the brain, a place called the substantia nigra. And in that part of the brain, there's decreased production of dopamine, which is a neurotransmitter that helps with all of that movement. And so the decreased dopamine in that part of the brain then leads to the most popular treatment of that, which is medicines that help increase or replace dopamine in the brain. In essential tremor, it's not as cut and dry. We do know that essential tremor involves parts of the brain called the cerebellum, the thalamus, and the cerebrum. And all of these parts of the brain help to control our movements. And so it's really important as we look at those things that the treatment is going to be different because it's affecting different parts of the brain. Some other things that will sometimes give us clues that someone has essential tremor is that it's more commonly seen in families. And so if there's a genetic history, dad had tremor and grandpa had tremor and the kids have tremor, that's a pretty good indication that we may be looking at essential tremor. Parkinson's disease also runs in families, but it's very common in essential tremor to see it running in families. Oftentimes, that spiral that the neurologist will have you draw, that's a really good tool for neurologists to distinguish tremors because when you draw that spiral, it looks very different if you have essential tremor as opposed to if you have Parkinson's disease, or even another type of tremor such as dystonia. The spiral will look different in each of those types of patients. And so that can also be a nice way of distinguishing tremors. I don't think I had any other specific things to present as far as the difference between these two, but it's just super, super important to take into account that shaking, if you're having problems with tremor or shaking, it's really important to get a good diagnosis. And if your physician is having a hard time getting a good diagnosis, then it's okay to look for a second opinion. If you have the opportunity going to a movement disorder clinic, a neurologist, there's a subspecialty in neurology for movement disorders, and those neurologists specialize in things like Parkinson's, essential tremor, dystonia, and other movement disorders. So if you can get into one of those providers, that's a good way to distinguish the diagnosis. Sometimes it's a real easy diagnosis, and sometimes it can be a little bit tricky. And sometimes a patient will actually have both diagnoses, and that can be a possibility. We know that people with essential tremor have an increased likelihood of developing Parkinson's disease as things progress. And so it's possible to develop that over time as well. So we're going to make sure you put any questions into the chat that you may have. And we did receive some questions. I'm looking for them right now. So here's a question that someone submitted. And this person says, my first neurologist told me that if I take a maximum dose of carbidopa and got no relief, then I probably had ET. Well, I got no benefit from the medicine. I went to another neurologist who diagnosed me with Parkinson's. It just makes me second guess the first neurologist. So this is really a tough situation. One of the common things when a provider is trying to distinguish essential tremor from Parkinson's disease is they'll actually give you a trial of the medicine. And if the medicine for Parkinson's helps, then that's a really good clue that you have Parkinson's or a Parkinson-like syndrome going on. And so that's the reasoning for what the doctor did, but that's not always the case. And so it's frustrating when you get different opinions from different doctors. And so for this person, I would say it may be good to, at this point, make sure you get in to see a movement disorder specialist to really distinguish the difference. And you could also ask for a DAT scan, a DAT scan, which can also help us distinguish Parkinson's disease. There's another question that came in, and this person asks, could spinal stenosis cause shaking of the hand or the leg? And the answer is yes. So spinal stenosis is when we've got a problem in the spine where one of the discs or something else with the anatomy is pinching the spinal cord. When we have that going on, there can be dysfunction in the nerves that are around or below the area of that stenosis. And so there could be shaking or tremor as a manifestation of the nerves that are being compromised by that stenosis pinching the spinal cord or pinching those nerves. The tremor would look different than Parkinson's or essential tremor, but yes, spinal stenosis can cause some shaking or tremors. So that's a really good question. Another question that someone answered is, I am unsure if I have ET or Parkinson's. My hands shake, but in different ways. My head shakes and my jaw shakes. My writing at times looks like unreadable chicken scratches, but I also have symptoms I believe belong to Parkinson's. I shake during the day, I shake during the night. My brother passed away due to Parkinson's, and my daughter has early onset Parkinson's. I went to one doctor who had me take a CAT scan and at rest and some kind of blood test. My second visit was about 5 minutes, and he told me the test results, walked out the door, and just said ET as he walked out the door. So this is a frustrating story. And again, the characteristics that you described of having your head shake, your jaw shake, your writing look like chicken scratch, that all sounds like essential tremor. If you're shaking while you're sleeping or you're shaking at rest, then those characteristics sound like they could be related to Parkinson's. And it sounds to me like you need to get into another neurologist or a movement disorder specialist to really distinguish this and maybe do one of those DAT scans. It's possible that you may have both problems manifesting. So we have another question here from Paul in the chat that says, could heart catheterization cause shaking in the left arm or hand? And the procedure was done in the right arm. So, Paul, not that I know of, I cannot think of how a heart procedure would cause tremor unless the heart procedure initiated what we call an embolus, which would be like a little small clot that went somewhere in the brain that then led to that tremor or that shaking to take place. So the heart procedure by itself should not have caused the shaking unless it caused something else to move from the heart to the brain and cause a stroke or a mini stroke or something that's causing the shaking. That's a really good question, and my advice would be to get in, and it may be a good idea to get imaging done of the brain, and a special ultrasound of the heart. Sometimes we can hide little clots, or we can have little things in the heart that can predispose us to having clots that then go to the brain and cause neurological problems or symptoms. Thanks for that question. Another question we got is, my neurologist says that I have both essential tremor and Parkinson's disease, but she took me off of my essential tremor medication. It doesn't make sense to me, and it wasn't explained. Should I seek out a movement specialist? So I can understand why that would be frustrating. In the medical world, doctors for many years were taught and are still taught that essential tremor is benign. And so I think that leads to the tendency for some physicians, when they see Parkinson's and essential tremor, they tend to ignore essential tremor and focus on Parkinson's disease. And it's not the right thing to do, but Parkinson's disease can progress quicker and sometimes is definitely more disease provoking and more brain damaging in its progression. So physicians sometimes will focus on that Parkinson's disease instead of the essential tremor, but it's not the right thing to do. Both things should be addressed. Both things should be treated, and we should take care of the brain so that we can help both conditions. So yes, in this situation, I would recommend seeing another provider or going back to your provider and request that they also pay attention to your essential tremor diagnosis. So really good question. Another question we got was, if essential tremor worsens over time, which mine has, what are the chances it will progress to my head and other parts of my body? I now have tremors in both hands, but it began 10 years ago in my right hand. Does anybody know or have experiences like mine? Well, first off, yes, your experience is not unique. It is common for essential tremor to start off more dominant in one side and then become significant in both sides of the body. It's also common for the tremor then over time to progress to the hand, or I'm sorry, to the head, to the jaw, to the voice, to the tongue, sometimes to the legs. So it does progress. It doesn't progress in everybody, but it's not uncommon to see. This is why it's important for us not to wait until tremor is really bad to start taking care of our brains. If we really take good care of our brains, then we can theoretically slow down that progression of the tremor and maybe prevent it from moving to other parts of the body. The last question we had is, as focused ultrasound has now been practiced for many years, have there been improvements in its techniques and results? And the answer is yes. Focused ultrasound is improving all the time. And we just went to our conference that the foundation put on in Florida, and we had a representative there from Focused Ultrasound, and that presentation was spectacular. Focus ultrasound is getting better. And one of the things that I love that was brought up in the conference was that when someone goes in for that procedure, before they zap the brain and kill that little spot in the brain, they actually will stimulate that part of the brain a little bit to see if it's the right spot. And then they fine tune where that spot is before they actually do the procedure and really knock off that little part of the brain. So the procedure is getting better. The procedure is permanent. So it's really important that you really go through a stepwise process of evaluating whether that procedure is right for you. Because if you have side effects from the procedure, some of those side effects will last a long time and maybe forever because the procedure is actually killing off a little spot in the brain. But yes, focused ultrasound is improving all the time. They're getting better. If you are thinking about doing that procedure, it's really important to do your homework, find somebody who's done many of those procedures so that you know you're in good hands. All right, here's another comment from Fred that says, gosh, absolutely everything you're saying resonates with me. I was diagnosed in 2016, put on several different medicines, producing a number of side effects. Finally retired from dentistry 4 years ago. I'm on no drugs since then. However, lately I've noticed a feeling of internal shakiness, especially in the legs. This is not necessarily visible, but it feels awful, an awful like anxiety. I'm extremely hesitant to ask for medication for this, and I'm wondering what else I could do to help to control this internal sensation, non-medical therapy. Fred, thanks for the question. There are many people with essential tremor that describe this internal shaking that you're describing. And it's not uncommon. We see in people with essential tremor, there's an increased incidence of anxiety. And I actually, as a provider, wonder if some of those diagnoses of anxiety are more actually this internal shakiness or internal tremor that many of us can feel from time to time. So I think that your situation is not unique. Many of us experience that. Some of the medicines that you've been described may actually help this. I appreciate your hesitance to ask for medicine because some of the anxiety medicines are just not good things for us to be on. They can be habit forming and can really lead to other problems and situations. So, as far as non-medical therapy goes, actually doing things to calm down the nervous system, such as deep breathing, meditation, biofeedback, neurofeedback, all of those things can actually help reduce that internal tremor or shakiness that we feel. In the work that I do with patients, we go through a series of different exercises and techniques to actually help them learn how to calm down the nervous system. And then things like chamomile tea, for example, is very calming on the nervous system and it can kind of help smooth out that internal shakiness that some patients feel. So really great question. Any other questions? You guys can feel free to unmute yourself and ask a question, or you can type it in the chat here.
Yeah, I want to really thank you for those comments. Like my diagnosis came very quickly, but in order to operate the next day, they prescribed Ativan, waiting for the
Oh,
propranolol to take effect. And 2.5 years later, it was a bit of a nightmare, and I finally just had to pull the plug when I needed more propranolol to operate. I finally just had to sell my practice, and I've been doing pretty good. And everything you've said is 100% what I feel I experienced. My tremor was blamed on anxiety. It's most prevalent when it's an intention, when I'm going towards a target in my
yeah,
patient's mouth. And, they just kept saying, well, you're anxious. You're anxious. Well, yes, I am anxious. Of course I am. Very anxious at the moment. And I've noticed that when my heart rate goes up, even to this day, it seems to be that when my heart rate is stimulated in any sense, if I'm doing a bit of extra work or if I'm working out or even if I'm excited in a good way, then I notice that added shakiness. And so, but lately it's been a little worse, especially
yeah,
since I tried not to use alcohol to control it, and
yeah.
which helps, of course.
Yeah, so alcohol does help the tremor, but it's also been shown to make the tremor worse.
Yeah, I understand.
And so alcohol isn't a good solution. Ativan is a
Terrible.
alcohol-like drug, right? And so
Yeah.
it can calm the tremor, it can calm anxiety, but it's just really awful for the brain. And long term, it's not a good medicine. I can certainly relate to your situation. Being a physician, I practiced OB for a number of years, did surgeries and did procedures in my clinic and got to the point where I had to stop. Right. And that's super frustrating. Another thing for you to just be aware of is in my practice, I've seen many dentists with Parkinson's, Alzheimer's, and other neurological problems like ALS. And as dentists, you guys are exposed to a lot of toxins. And specifically, I think it may be related to the mercury exposure that you guys get over a long period of time of drilling that stuff out of teeth, putting it into teeth. I know we don't use it as much anymore, but
Right.
I've seen a number of dentists with neurological disease. And so for you, it may be beneficial to be really proactive about helping the detoxification systems in your body to help eliminate any toxins that are still hanging around from all those years of dental work that you did.
Yeah, I'm sort of counting right now on the neuroplasticity of the brain to help me along here. I'm really have my fingers crossed that I can just tone things down and get back to a little bit more of a healthy lifestyle and whatnot to help sort of
Yep,
reconnect those neurons. So,
yep, super, super important. And we just know that this is a degenerative process. And so if we can jump in and really take good care of the brain, then the chance of that progressing goes down, the better we take care of our brain. And then doing things to stimulate neuroplasticity is important. So learning new skills and challenging the brain, all of those things are really important.
okay, that also resonates with me. I appreciate the conversation. Thank you.
Yeah. And you can, my personal work, you can find, we just started a YouTube channel called Shake Free. And we've working on a website called shakefree.org. And then we're getting ready to launch our first Shake Free mentorship, where we're going to walk people through this process of neuroplasticity, taking care of the brain, all of those things.
Yeah. What is your website now? Tell them you.
It's shakefree.org.
So if anybody wants to go there to learn more, that's where you can get in contact with Dr. Drew. And I agree, Dr. Drew, you bringing up healthy diet is one of the big things that I've learned with my ET. That when I go off my diet, and I'm a non-sugar, but if I go off my diet and eat more sugar and all those, other bad things, really, my tremors are worse. It
Yeah.
really does affect your body.
Absolutely.
So, the old saying, what you eat is who you are type thing, it's what your body does, is the truth. So that
Yep. Absolutely, absolutely is true. I see it especially like in my Alzheimer's patients. When I have Alzheimer's patients come in, when we get them completely off of sugar and processed carbohydrates, we actually see their brain improve.
Mm-hmm.
And if they go off of their diet, their brain function goes down almost immediately. And the interesting thing is then if they go back on the no sugar, low carbohydrate food plan, they don't get back to where they were before. And so sugar is another one of those things that is really damaging to the brain. And in fact, nowadays we call Alzheimer's has another name, and it's called type 3 diabetes because it's so highly linked to sugar. And so, yeah, sugar is very addictive and it's everywhere in our society, and it's really bad for our brains.
And there's plenty of alternative ways to get sugar to cook and have your desserts. I've learned those over the last 20 years. I mean, it's amazing how just a little change can help you. So I agree with that.
Yeah.
Any other questions? All right. Nothing else on the questions. Well, this has been very informative to me, even because I've never really discussed Parkinson's, because my tremors began when I was so young that, it was, I had a great neurologist too, but automatically essential tremor. And, but I know this link is there. And I think it's great for us when you go into a neurologist or movement disorder doctor. You need to know and understand what Parkinson's is and what essential tremor is, because you are in charge of your body. And you need to be able to discuss that with the doctors.
Yeah,
so anything
really
else you
important.
want to say about that? How to discuss this with the doctor, maybe?
Well, when you go to the doctor, you can go in there with, your list. For example, if you're worried about Parkinson's, you can ask for a DAT scan, a DAT scan.
Explain that. Explain that to us.
So it's a specialized brain scan that really looks at the dopamine transporters. And so it's really looking at dopamine functioning in the brain. And when it's abnormal, it really helps in making a diagnosis of Parkinson's. And when it's normal, then the likelihood of Parkinson's is almost zero. And so when there's a question between the two, or if both are there, sometimes that can be a really helpful tool to ask for. And so I think it would be good to ask for that. It's unfortunately, as in that world, once they make the diagnosis, the common thing is to then just prescribe the medicine, right?
Mhm.
And if you want a non-medicine answer or therapy to help you, that becomes more challenging and harder. Most physicians won't know how to help you there. But I do think it's important to get a really good diagnosis. And so if the physician seems unsure, then challenge that a little bit with questions, and ask to be referred for a second opinion, because it's really important to get the right diagnosis, because the paths that you go down are very different and the therapies are very different.
And the medications that you take for Parkinson's is not what you need for essential tremor. And
No, in fact, they could actually make them worse.
right.
Yeah. Yeah, because so just like you were saying, Fred, anytime your heart rate goes up, your tremor gets worse. That's really common because that's the sympathetic nervous system firing to when we exercise, when we get excited, either bad excitement or good excitement. That sympathetic nervous system releases adrenaline and those sympathetic neurotransmitters. Well, dopamine is in that family of transmitters. So when dopamine gets broken down, it becomes an adrenaline-like neurotransmitter that can then lead to more, for us, lead to worsening tremor because it's more adrenaline in our systems highlights and enhances that tremor.
Yeah, I
And
would agree with you. And you know, I do want to be excited in a good way, like in a
Absolutely.
full way. So it's like, wow, I want that, but at the same time, I'm trying to do everything I can to control my heart rate. But I would add with the diagnosis, because it sounds like that's what this meeting is about. My mom, and given the drug, it did not. And having an advocate beside you can help as well. My wife go to all the neurology meetings, you know, the 3 or 4 different neurologists I had, and just having her there as with my mom, I was advocating for her, and they deemed that it wasn't Parkinson, and that was a huge relief for her. And
Yeah.
hers is shaking now, but that was at least a degree of peace of mind that she had the diagnosis.
Yeah. That's a great point. I I love it when patients come in with their spouse or with a sibling or with their child, and having someone that advocates for them is really good. But also, other people notice things about us that we don't notice about ourselves. And so I think that's a really good point that you bring up. In when you go to the doctor, take your spouse, your significant other, anyone that helps share in your health related decision making, taking that person with you can actually be a really big asset. So, yeah, that's a great point. Thank you.
Dr. Drew, thank you. And
Yeah, thank
this
you.
was really interesting. Like I said, even I have not uh, delved into Parkinson's like I should. You know,
It's important to know a little bit about it so that we can keep our eyes open, right?
it is. I learned a lot of those little tidbits you said uh, that I didn't realize the differences. There are distinguished differences that we can keep informed because you can have both.
Yeah.
So you want to keep up with it. So thank you for being here. We
All right.
really
Thank you.
appreciate it.